Right, we'll call the meeting to order. And Dr. Kidder had a pre-engagement, so I'll be your host for this evening. Um, Do we have privilege of the floor? I see some folks are here. So our rules are, and feel free to add to it, girls, 3 minutes per person or per group. And the girls usually are staffed 30 seconds before your time is over, just like Academy Awards. They'll kind of give you a little hint, and you know that time is coming to an end. If you have any information to submit, we'll take that. We do not respond. And then, of course, if we need to, as a Board of Health, we will respond in writing afterwards. So thank you. Anyone here that would like to speak or to the board?
Hi, sir. My name is Borinder Multani, and I'm from the Share Fund, Casadega. And I supposed to become on the hearing like beginning of the month, and I have a little car accident. Then I missed my board hearing. Then I called again to the health department. They say you can come to the board meeting and you can explain why you were couldn't attend the hearing. So the thing, I have all the reports like from the January till now, every single day. For unfortunately, I think I was misunderstood. I can submit after like 11th or 12th, and some of them I submit before 10th, and some of them I missed a day later. That's why I think they couldn't go through because of maybe my emails or my Wi-Fi something happened. That's why I missed the report. But I have everything with me, and I sent the email. So I look at all the emails and I printed off.
If you have things to submit, please do so to the staff, and we'll review those and respond accordingly.
Oh.
Anything else you'd like to add?
That's all. That's why I missed. I'm so sorry. And I wasn't know that I have to submit before the 10th. And now I know I will do like when end of the month after 30th, I maybe on the second or first preference to give it to submit the report.
Well, thank you for
And
coming.
I apologize for that.
Okay, thank you. You can, go ahead and submit the report. Anyone else that would like to mention anything to the board while we have the privilege of the floor? Okay. We'll move on then to the approval of minutes. If you have all had a chance to review the May 21st minutes or would like to review, once you are ready, I will entertain a motion.
I'll move to approve.
Don is first. Any seconds?
I'll second.
Mark Carbrick, second. Any opposed? So moved. The minutes are approved from May 21st meeting. And then comes the agreements to settle. Jessica.
Okay, folks, so you have your list of agreements to settle here. And as you can see, we're continuing this. More information is good information for the Board of Health members. We have the amount of the fines that were actually paid, and then a little bit extra information in parentheses there, about the frequency or the repetition of this sort of fine that we've in violation that we've cited for the facility. I will say that there are a few of the incidents on this agreement to settle. There's been a change in local business. The lab that had been hired by a lot of facilities, there's been a change in ownership and operation of that lab. So unfortunately, some of these facilities were caught in a situation where they thought the new lab knew that they had to send results to us, but the new lab didn't send results to us. Unfortunately, we just need the results. We don't go after a lab. If the lab has missed a result, we go after the operator to cite the operator, because ultimately it is the operator who needs to be following up with their lab to make sure that results are submitted to us. So unfortunately, some of the bacteriological and microbiological monitoring requirements that you're seeing on these agreements to settle lists, it is a result of that situation. The samples were done, but the results were not actually submitted to us. And we have a state system that we have to check the boxes, and, our information is audited by the state. So when we don't get it, we don't get it. And we can't follow through any further on that. So we have certainly been working, to help these facilities sort of iron out the problems they're having with this new lab situation, and remind them that when they get an email from their lab and they don't see us copied on that email, they need to forward that information on to us. And, we've been doing our best to provide that little bit of extra education, but ultimately we have regulations that we have to follow. And if we don't get the results, a violation has to be issued.
And I think it's important that what you just mentioned, that if there is any issue in obtaining results, vendors or folks should be contacting you and letting you know that there is an issue with those results, rather than not submitting the report. So you are aware, or your department is aware. Thank you.
And then also new to your list of agreements to settle, I've been trying to add again more information. So we've got some updates on recent Board of Health orders that were issued, and notations about fines that have been paid. I will note that under your Board of Health order updates, the third case with Kilo Cookies and Cream, their fine was due by today. It was not paid. So we will be reissuing a notice of violation, and contacting that facility to sort of figure out what's going on here. So you'll be seeing something one way or another about that facility again in future meetings. And then lastly, as we've discussed previously, these monthly reports that everybody is required to submit. When a business misses the very first monthly report, we essentially give them a warning that we're not going to issue a fine for this, but please remember, this is what you need to do. This is the time frame. If you have any questions, reach out. So we did send 13 of those notice of violation letters for missing a first report. So then if they miss again, they will incur a fine.
Is that typical of every year about that number, or is this more than normal?
It seems a bit more than normal, and I don't know, there seems to be something going on lately. I don't know, I know the world's a little extra stressful right now, but it seems like we're issuing more letters of violation, more notices of violation recently.
People
For
are
some
just
reason.
less compliant.
Yeah, like I said, I know some of it is this lab changeover situation, but things like the monthly reports, I don't know, we're having a difficult time understanding why we're seeing this trend. Yes.
Tracks.
Yeah.
Ms. Multani, you don't have to sit through the whole meeting, but you can if you would like to. So it's your choice. Just wanted to mention that. So, you're welcome.
So any questions on the agreements to settle? Do you like the extra information? Do you want me to keep doing this? Okay, all right.
It's just very nice to have.
Okay.
Okay. Next item is yours too.
Yeah, me too. So this first findings of facts is from a hearing that was held on June 29th with your Board of Health hearing officer. This relates to a business in the Jamestown area called Smoketown. Unfortunately, through our routine inspections, this facility did sell an illegal flavored vape product to a minor during one of our routine inspections and checks. The details of the hearing are in here. I would like to point out that this facility did have a previous Board of Health order that was issued in 2025 which it has not paid yet. So they are currently in violation of an existing agreement, Board of Health order. And then now we have this Board of Health order. So that first Board of Health order, they did receive 2 points on their license. Depending how the board votes here today, this new case will be an additional 2 points on their license, and that would move them forward with a recommendation for a 1-year license suspension.
Are there any financial penalties as well? I don't have my Cliff's notes here.
Sure, so because this is, not their first violation, the range that we are allowed to fine them for would be $1,000 to $2,500. So you guys can choose where you would like to fall on that. There's also a $100 fine for the illegal flavored vape product. And then with these ATUPA cases, there is always a $250 surcharge, and that is per violation. So there are 2 violations in this case. So you would add both 2 surcharges. So you'd have $500 per surcharge surcharge fine.
Okay.
So yeah, so again, it would be up to you in that $1,000 to $2,500 range.
And I know that they are probably the easiest place for a minor to buy in all of Jamestown.
We
It's
have
frequent.
received a number of complaints
Yeah.
about this facility as well, yes.
You remind me how many points they get for their,
So it's,
I mean, 2 and 2, so they'd have 4.
correct.
And what is the number that they,
3 points is a suspension for 1 year. And then if you remember from previous instances, once that suspension is issued, we are charged to go back in and see if they're complying with that suspension. And if we find reason to find them at fault for not complying with that suspension, that's when it could potentially move to a complete license revocation from the New York State Department of Tax and Finance.
So suspension is for all tobacco products.
Mhm.
They sound.
And lottery
lottery.
stuff, yeah,
Oh, yeah, it's
Yeah.
huge.
yeah.
It's huge.
gotta be 99.9% of their bid.
Do I have any motions for consideration from the board members?
How much did they still owe from the previous?
$2,000 is the
Okay,
previous
so we
Board of Health order.
did do 2,000 before,
Mhm.
so. I would recommend the max.
Yeah.
I would.
And then this plus $600.
Yeah, plus 600.
That's $3,100.
3,100 plus 4 points, right?
Well, 2 points.
2 points.
Yeah,
Two
to
for
give
the
them a
prior.
total of 4 points, yeah.
Plus the 2 they have.
Would you also like to include language in the order addressing the current outstanding Board of Health order and the fact that they still have not made that?
Absolutely, I think so. Okay, so who was the first? Yeah, and Marty, did you second? Or
I will.
Was it Dawn?
I will too.
So who,
So with the 4 points, is that automatic suspension then?
It'll have to go to, I mean, we send it up through our New York State DOH channels, and then it works through that system. So it depends on the timing. Sometimes it takes a couple of months to get all of that processed before we actually get the notice.
Impending.
So can I just go over the dollar amounts again? So the $2,500 fine you're recommending, plus there was $1,000 automatic, because
Well, 250, 250 and 100.
100.
Yeah.
Okay.
3,100.
So it'll be 3,100.
Added a 0.
In addition to the 2.
Yeah.
Right. that they-
In addition
that
to the
2 they
that
already
they
owe.
already owe.
So Ken brought the motion forward, Marty second. And all in favor, say aye.
Aye.
Any opposed? So carried. Thank you.
Thank you, folks. Okay, so the next one is regarding the Surefine facility, which we had our previous privilege of the floor was here, to speak to the situation. So we did hold this hearing. The respondent wasn't present at the time. They did have the notice of hearing mailed to them, certified mail, so they did receive it. They had spoken with us prior to that date. They acknowledged the date of the hearing. They can send anyone as a representative. They don't have to come their individual selves. Again, nobody came to the hearing. Unfortunately, this violation or this case is noting 3 missed reports. 2 of them did eventually arrive, but they arrived late. But there were a total of 3 reports that we did not receive by the 10th of the following month.
Those are the ones from 2025? Is that what you're referring to, or?
No,
So January 26th
Okay.
report
Here it is. Okay.
came after the 10th of the following month. The March report we didn't receive. The April report came
Okay.
after the 10th of the following month.
But then they were also late 3 times last year in 2020.
Correct.
were they the same owners last
Yeah.
year?
Correct.
They
How
were,
about,
okay.
since April?
So since April, they have had another one that we plan to issue. Is it? No, I'm sorry. Since April, they are in compliance.
Okay.
Yeah, that's good.
For your reference, these are the documents that were brought today.
So remind me again, what kind of education do these establishments go through? Because, in her defense, it sounded like she was a little confused
Mhm.
about what she needed to do. I realized, the lateness of the reports and everything, but what kind of education do you get?
Sure. So whenever a brand new system starts up, we go out, we talk to an operator, we go over the forms, we go over their system, and, we do our best to get them rolling in the right direction. Additionally, in the winter of every year, usually January, February, we send out a packet to every single public water supply, reminding them of the timeframes, of the due dates, of their individual sampling requirements. So they do get that packet every winter.
So a grocery store has to sample because,
So they are regulated by the Department of Ag and Markets, New York
Yes.
State Department of Ag and Markets. And New York State Department of Ag and Markets determines which facilities need public water supplies. And they tell us, congratulations, you're now regulating this facility because they meet the requirements under their Ag and Markets permit. This particular facility does food preparation, they have a deli case, they do all sorts of things. So they certainly are using their water, for that reason. Something like the Dollar Generals also are public water supplies, but they're public water supplies because they have a water fountain outside of their bathrooms where water is readily available to the public. So we follow the, I don't know, the facility, there's a memorandum of understanding with the New York State Ag and Markets that says Department of Health will do these things for
Right.
Ag and Markets when we are told to.
Got it.
So that's why they,
They sell tobacco now too, don't they?
I believe so, yeah.
Because I think some interesting stuff is showing up there.
Well, unfortunately, as you well know, there are a lot of products
Yeah.
that show up that are just outside the realm of what
Yeah.
regulations exist.
Yeah,
Yeah.
I stopped in a couple weeks ago and I noticed, yeah.
Jessica, for reference in general, about how many facilities are being tested on a regular basis? So like in terms of how many, what's the failure rate basically amongst all of the?
or the other way, how many facilities are in
Right.
compliance percentage wise?
So I'm trying to figure out how to simply answer your question. So, I mean, there's a number of different things because there's the monthly reports that they have to do. There's sampling that they have to do depending on the size of the facility. There's a whole lot of sampling that they have to do.
So like in general, how many establishments are there?
237 public water supplies, I believe, and that includes everything from a Dollar General to the Village of Fredonia.
So potentially 230 plus that could be in violation in a given month.
Sure, yes.
And we see 10.
But based on what we're seeing, it doesn't look like we have a huge fallout. The
You-
majority of them are in compliance. It looks like, just based on,
Yes.
Same.
Numbers, yeah.
you-
and then there are certain ones that are always not in.
Less than 10% that we
Yeah.
see.
The large majority are, the large majority have figured it out and are in compliance.
So after hearing from the owner, oh, go
Oh,
ahead.
I was gonna say one more thing.
Yeah.
So in relation to the fines for these violations for this case, in accordance with the compounding fine schedule that you folks agreed on, it would be $300 for the January fine, $400 for the January report, $400 for the March report, $500 for the April report.
So 1,300
Correct.
plus
And
250.
if you would like to add your administrative fee, that would be an additional $250.
I think we always have the administrative fee.
Yeah.
That's the judge and the attorney there.
Yeah.
Like the New York State surcharge on a speeding ticket. I can't get out.
Any hesitation, any further discussion? Otherwise, I'll entertain a motion.
I mean, they had 3 violations last year too. She said she had a car. I had a hard time understanding.
She did say car accident
Car
and
accident.
pointed to, yeah.
She couldn't be there. But saying that she had 3 violations last year.
Well, hopefully it won't be. any.
Do we know when the notification came through that she couldn't attend or she did not?
She
not.
called us, I believe it was 3 days after the hearing, to ask about the hearing and ask if she could schedule a hearing. And we explained, the date of the hearing, the time of the hearing is on your notice of violation that you've received and acknowledged that you received. So the hearing has already been held. And that's why we, let her know about the meeting tonight. So if she cared to share any information or make statements.
It's not like I was in an accident, I can't get there. There was none of that.
What did we do last year?
So
there
last
were
year,
hearings?
last year, the very first miss would have been April 25, and we sent the warning letter saying this is what you need to do to comply moving forward. They missed in June of 25 and July of 25, so that was $100 for June of 25, $200 for July of 25. So those would have been their 3, and now we're here with these 3.
There's a pattern.
Yeah, there is. Did she show up to the hearing last year?
They signed agreements to settle.
They said.
And they had that opportunity to do that this time and did.
I mean, we do the 3, 4, 5 plus the administrative costs.
So Marty first, Dr. Cron second. Any opposed? All in favor, say aye.
Aye.
Carried. Thank you.
Thank you, folks.
Right. Anything else, Jessica?
I think I'm done.
Jessica, can I say something?
Absolutely.
Because it's environmental health.
Okay.
We lost an old member of the environmental health team, Don Husted, passed away a month and a half ago or so.
Yeah.
He had had a stroke and then fell at home, hit his head and died. And tragically, his wife was the lady
Yes,
hit on by the,
she was
Truck.
my sixth grade teacher.
yeah,
A few days ago.
and she passed away. Plus, their house burst a pipe and the whole house is basically a disaster. And so she was dealing with both of those and then, and I saw her about an hour before she went home on her bike and got hit by a car. Tragic.
And that truck.
Yeah, and then another member of our whole environmental team, Mike Vendetti.
Oh, yeah,
Passed away.
that was way before me.
Yeah, he did. He was also very much involved with bioterrorism and when all that was going on. He passed away last week, I think. Anyway,
Well, thank you
I'm
for
sorry.
acknowledging that
Well,
and the history there. I did not realize
Yeah.
that Mr. Husted was.
oh
With
yeah,
the
he was,
department.
I mean, they had a group of them that were for years, Vendetti, Husted, Steve Johnson, there was just a whole bunch of them that were here, forever, it seemed, doing the same kind of work you're talking about, day in, day out, Anyway,
Thank you, Dr. Burke. Old business. Any old business? Right, so the new business, I'm just gonna mention the new business because my inbox, and as I'm sure most of your Academy of Pediatrics Environmental Health Committee has been on it, and as I'm sure you all have been with what's going on with these smoke coming from up north, and people dealing and struggling with health issues, especially kids with asthma, allergies. Not everyone has air conditioning in our area, and even air conditioning, I mean, if you don't have the
Poor
right
air
filters,
quality.
things are coming through, so tough times, but looks like it's gonna dissipate in the next day or two, supposedly, so fingers crossed. Director's report.
It is nothing back, so. Don't get too excited, it was just the front out there. But always wonderful to be with you all. Before I get started on the contents of the report, I did just want to acknowledge a visitor that we do have with us. Jim probably does not want to be put on the spot, but Mr. Jim Williams is legal counsel that has been with the county, but now with the county legal team and helping to represent work in the health department for us. So he's been a wonderful addition to the health department, provides great counsel, very responsive for us. Very excited to have Jim, and thank you for joining us tonight. So if you do have a minute to introduce yourselves afterward, any bits of background or information are probably helpful for him as he's learning and picking things up. But to move on to highlight a few new things, of course, there are always many different things happening on the day-to-day. But the Rural Health Transformation Program, I just wanted to give you a quick overview about what that is, because there will probably be, especially in the circles that you work in, discussion at some point about these. So I wanted you to feel very equipped with the info on what it is. This is money that is originated at the federal government, was made available through application by state. The application process and decision-making process was happening during the time when there were a lot of fiscal sort of restructuring happening at the federal level. And so New York was not confident that they would be awarded. Lo and behold, they were awarded, and even at a greater amount than what they had thought, at 212 million just for the first year of funding. We would have liked to have seen, as public health directors, more participation with the state department as they put in the application to really inform their application and what they were submitting. There was not very much interaction with us on it. But we have advocated very heavily for it. And since then, as they are rolling out some of the application materials, they have been very responsive and very inclusive. There is specific guidance even in the applications that local health departments need to be like a named stakeholder at the table for organizations and collaborative groups that are being formed around this funding. Of course, on the report, put some information there for you in terms of like what the real priority and focus areas are. But really the central expectation is about developing sustainable or even revamping systems. But sustainable system change rather than short-term isolated funded projects. They, of course, are funding projects as part of it, but really the whole impetus for this is to allow rural communities and networks, even around regions, to sort of do their own look at where the gaps are in their systems, where the challenges are, barriers, what assets are there, and really plan for what the rural community around them in terms of healthcare access really looks like and what it needs. So the group that has formed actually within our county and extends even out of our county into Cat County and Allegheny County even has formed really months before the application was even released. All three hospitals have been at the table, working seamlessly together. You would think that they, do this every day. So that has been wonderful. Other community partners, CHN, the rural, the AHEC, JCC, our educational partners. I mean, too many to name, but you name it. And as the meeting sort of went on, really gained a lot of great momentum and more partners joining the table. So that has been a great effort so far. There is, an application that has, been submitted for round one. And we have had the pleasure of being asked to continue to be at the table. And we're really just supporting the efforts of the frontline organizations and the other community organizations that are at the table. So there's some great opportunities there. Of course, funding is never guaranteed. It is an application grant process. But it would be a major mistake if the state health department did not, fund this really wonderful collaborative that has come together. So of course, that's my biased opinion, but really, truly, it has been such a hopeful experience for me to be a part of, to see the partners come together in this way. And just the discussions and what they're talking about that needs to be transformed. I can assure you all that it was not the protect ourselves, get something funded in our neck of the woods type work. It truly has been about what is best for the community. Seeing hospital partners step out and say, there is a major educational component here that needs to be addressed. And the educational partners stepping up and saying, how can we support our hospitals and our CBOs? It has been a very wonderful experience. So we don't always hear that. I wanted you all to hear that today because it's a wonderful thing for our community. Summer outreach is in full swing. Of course, we have our regular immunization clinics that we do partnered with groups and outreach events that are already occurring in the area. Of course, we're doing that very thoughtfully and mindfully around specifically our measles vaccinations. And there's some other great work in the coming months on the measles front that I will look forward to presenting to you all in terms of messaging and outreach to our communities. But one that I wanted to draw your attention to specifically is the Every Moment Counts Hepatitis C outreach event. So Chautauqua County has historically had significantly high rates of hepatitis C, and it tends to be most generally associated with intravenous, drug use, illicit drug use. So this event is a model and a best practice that has been developed by Dr. Martinez out of ECMC, who is widely recognized, really even internationally recognized, as a forefront provider in terms of hepatitis C outreach, testing, and treatment. So he is partnered with local organizations in our community listed here. Evergreen Health is sort of a lead in this endeavor. Joy Fellowship Church and Fidelis Care are really sort of the main players, of course, along with our health department team. Um, and this event really is sort of one of a kind in many ways. They do have testing equipment right on site and results are processed really within 20 minutes. And then they do the follow-up testing if necessary also there right on site. The reformatory or confirmatory testing, sorry. There's a meal provided. So that's what makes it such a pleasure to stay and wait for your results. So if you would not mind, of course, amplifying this event, it will be right in downtown Jamestown, so very accessible for people, even to just walk right to the event on 7th Street in Jamestown. So we are very excited to have that opportunity here for our community members. They will be linked to follow-up care through that event, whether TCC or Evergreen, or any local health home that they already have, or getting connected to one that they don't have. And of course, anybody from the northern part of the county as well, ECMC will also link patients right to their services as well through it. So a wonderful opportunity there. Yeah.
The mobile units being used for this
Yeah.
event. I have a general question about the mobile unit. Maybe we can do it later.
This is perfect time.
Okay. How often is it being used as they go? You said this is just the highlighted event, but.
Oh, yeah, weekly basis.
Yeah.
Yeah, weekly basis between both outreach events. So, like fair and different things like that we go out. And of course, we're just connecting with individuals in terms of outreach materials, making sure people are aware of the services that we and our partner organizations provide.
Yeah.
It often, during those events too, specifically ones like the fair, we open it up as a breastfeeding and lactation space for nursing moms, because there's not always wonderful accommodations, of course, that wasn't thought of when we were building fairgrounds, necessarily years ago. So it is an air-conditioned, cool, quiet, and confidential space. So it's used as sort of dual purpose for our outreach events in those ways. And then we also have, of course, our immunization and vaccine clinics. And those happen at multiple spots throughout the county. So it's typically I would say on average, basically what it is it's an outreach event 1 week, a vaccination pod the next week, every other.
How does an organization can request they come to our town and
For the pods that should do like an immunization or even outreach? Yeah, we're honestly getting requests all the time. And so even we do more outreach events than just with the mobile unit.
Yeah.
So that's where the mobile unit is,
Yeah.
basically like, every other week or so. But every week we're doing something around outreach, whether it's a specific divisional team, or it's just in general as our organization. So those requests coming through our communications coordinator, and she takes all of those requests. There's a team that's, plans out who's going where when. And then we do work, the most recent expansion of our vaccination pods is specifically with the schools. So we've done a large outreach effort with the schools to say, do you need us to come in? Are your students and families struggling with meeting the immunization schedule before school starts? And we will bring the mobile unit right to their spaces and vaccinate there. We also do, of course, vaccination pods outside of the mobile unit as well. And we're mindful of that in terms of the types of communities that we're trying to reach. So it's not always, the best route to go to pull up a big van with a government symbol on it. That doesn't always, attract everybody. So we're thoughtful about that, specifically with our plain communities like the Amish and things like that. Instead, what we'll do is we have partner relationships with churches or fire halls in their area. And so we're still doing that type of work even outside of it.
I was just asked that question today. I really haven't heard, maybe my head's buried in the sand.
Yeah, no, we are out and about and on our social media pages.
Yeah.
We're often showing where we're at, and on our website, you can also go, there's a whole mobile unit section and it shows you where we'll be when.
And then someday when you come to the committee,
Yes,
touch on.
yeah, we'll do that.
Okay.
Going
Wonderful.
back to
Sorry,
hepatitis C,
great
is everybody automatically assessed in the jail?
So I actually,
That's
I
fine.
wish Dr. Falk was here for that. I'm sure it is part of the screening systems there. There is a pilot program that is also happening right now too, with linking through a telemedicine model for treatment through it. So there is absolutely some type of screening that is happening there. I just don't know if it's on intake or if something flags on the intake that then Hep C screen is done at that point, but I can imagine.
Yeah, you can would be another.
I just saw that they had this certification process for the professional health.
Yes, and it's,
And I don't know if Hep C screening is part of that or not.
yeah, and I know that it is part of their process there. I just don't know where in their intake process. Like I said, like if it is on initial intake or if it's once they're in, and there's the larger assessment done. I don't know where in there.
People are in and out.
Yes,
Yeah.
that's exactly the point. And that's where all of the accreditation work comes in, as all of the policies. At what point are people screened for these things and how comprehensive is the intake? I see your hand. I'm so sorry, but we can't take public comment during this time. I'm so sorry. So the other, any other questions? Or we move on from that?
I just have a comment. I love the van visiting the schools. That's really true public health. So awesome.
Thank you. And actually, Dr. Cron mentioned, I should have said this to begin with. This is the department's annual report for 2025. It is condensed to be much more digestible. If we really gave you every metric and data system, this would be, 97,000 pages long. So really, we've condensed it down to make it very approachable for all of our community-based organization leaders, our elected leaders, you all, because we want you to interact with the information. But I hope that you'll find that it is also meaningful information and evidence-based and data-based. One of our strategic priority areas over the last couple of years has been really bridging that gap between the narrative of what is wonderful and meaningful work that we do in public health with the foundation of it being evidence informed, and that we're tracking our data, or we're tracking our outcomes with real data. We don't always get everything right. I try my best to be a really meticulous planner. And so I'm always very confident in the things that we're going to try to do and try next and pilot. I can say 9 times out of 10, we get it nailed right on the head because it is evidence informed. But that 10th time, we might find that that wasn't really the best approach. And we can say that with certainty because we've tracked the data. We've evaluated what we're doing. So then we know, okay, we're not going to put any more resources there. We're going to pull that back and we're going to move in this direction. So I hope that brings a lot of confidence to you all and to our community that everything that we're doing really has a metric and a data driver behind it. So we really know if we are making a difference or not. We know the stories are there and that's wonderful, but of course we're tasked in public health with, helping more than just the one person and their story. It's, the entire community that we're looking at. So hopefully that is represented here. You can share this if you would like a couple other copies. We try to keep the paper copies at a minimum. We can, because of course we have our environmental crew and staff in here that we are, integrate into all of our thinking. There are digital copies of this as well that you would have received in an email.
Yeah.
Any questions about the annual report before I move on from that? The other things, just some updates. Of course, we are well into the 2027 budget prep at the county level. We have completed I do a review with all of our division leads, and as part of my strategic planning, I do a staffing plan with all of our division leads all throughout the year, so that we're being really cognizant about our staff resources. We, of course, are very mindful that we are a public agency. So our goal is to not overstaff, and to only staff at the capacity through which our mandated services and the gaps in our community really require. And so to do that well, it is a constant conversation with our team leaders, and the help of our finance team that I can't speak highly enough about. So we've completed that process, and we are working right now with the finance team to get them all of the information they need collated, and put into the systems to then bump it to the next level, which is the county executive level review. And then of course from there to our legislature for the budget hearings. If I'm going to skip one bullet point or two bullet points to just highlight, that sort of ties into, and actually Legislator Proctor just referenced, us attending and our department attending the Human Services Committee. That is our preemptive committee in the legislature. And so we have made it a priority to present to them about our different services and programs or specific needs in the community, because they're, the work that they have to do during the budget hearings is overwhelming and it's comprehensive, and they're looking at every division. So to ensure that they feel very informed about our budget before we even get there, we go and try to, sort of sift through all of the details for them so that they just feel equipped to really look at our budget. We want them to ask questions, and we know that they are held responsible by all of us as community members. So to ensure that they feel confident and equipped, we provide that information to them.
I'm sure we don't get involved.
Yeah, right, yeah, you can always ask, which
But,
you
I
I do,
know.
but yeah.
But no, they're very informative. Very much.
The last two bullet points to just highlight, our children and youth with special health care needs program. You'll remember that is a state mandated program. It is a culmination of services provided to children 0 to 21. It's an all-encompassing program. The state did make available some funds, if you remember, through the Community Assistance Initiative about a year ago. Again, through our planning with Steve Kilburn and Melissa Losandro in our office, and Denise Sniffles is the lead in this program area, got together, developed a pilot program of how they would use that funding. And they wanted to use it to sort of, again, develop this pilot to study what group services would look like in this space. So typically through these programs that we provide, we're mandated to ensure that children have access to professional services if they are experiencing delays, developmental or physical delays. The limiting factor, a couple in this program, typically around provider access. We just do not have the number of providers needed to really serve all of the children and families that need these services. And there's also other social determinants that become barriers for these families. It can be isolating to have a child or children with developmental or physical disabilities. So isolation and social isolation becomes an issue. And then there are other services, just nutrition education and things like that, that are not readily available all the time in our community. So this pilot program brought all of those things together in a really fun and interactive way. It has been extremely successful. The leaders of that program were asked to present at the New York Station conference with a lot of wonderful feedback there. And we've just received word that they will be funding year 2 of that program. Out of the program, that the first pilot that happened during the school year was so successful, and we had more than enough families, that we could serve. So the summer program has started, and they're calling that Summer Sprouts. And in the mix of that as well as you all know, transportation is obviously always a barrier as well. So we've built in a transportation component as well over the time. And just some really wonderful stories. We're going to do some narratives around that. There is a video that we shared with the legislature. I'll make sure that you all get that as well, because it's a really beautiful thing to see. And as the director, to see team members who are just so passionate and coming in every day with new ideas and just all that they want to do for the program. It's been a wonderful experience.
But when the rubber hits the road, how long does it take for you to get a child assessed up in Buffalo
Yeah.
with the developmental, like 6 months, 4 months?
Longer, 7, 8
brutal.
months, yeah.
And so it's a great pilot, but
Yeah.
the reality is for the majority of what's going on out there, the delays are just,
Yes.
they're impossible for parents who have a child who's obviously struggling. And this is,
Some of these programs, something similar to that would be helpful. I'm also privy to some of the details of the Rural Health Transformation Grant that the county is filing. And there are some key components that if those dollars are awarded, there are some key components around transportation, maternal child health component. So I think that will bring it together. But yeah, it's frustrating. When we had a couple of programs, the hope was, which are not here in the county anymore, to develop a local center for evaluation. I think that will be someday, will be to have that right in the county. There's so much need.
It would be
Yeah.
absolutely amazing
Mhm.
for so many different reasons in that sense. And specifically with Rural Health Transformation Program, there is not only an initiative, but significant desire amongst the collaborative to focus on the workforce pipeline to the community, because we do have wonderful education partners, retaining students and retaining them once they're professionals, because of the competition with, very close cities, Pittsburgh, Buffalo, Cleveland. So that I can assure you has been the central topic of conversation amongst all of the partners at the table, for these very reasons, whether it is PT, OT, speech, dental, hygiene, respiratory therapy.
Dentistry, nursing.
Yes, yep.
I just like to highlight a little bit about the Rural Health Transformation Program. This is a big deal. I just got an email from Newsweek, was having a webinar about it later this month, so on a national level. But I haven't been privy to the meetings that Lacey's been at, but Chautauqua Health Network has kind of bubbled to the top. They were the ones that submitted the proposal to the state on Tuesday, and at a board level, I was absolutely thrilled to see Tracy Gates from UPMC and Ken Morris from Brooks talking with each other and with concern about the local community, because initially when the hospitals that were remaining in this county partnered with outside hospital systems, the concern for the local community, I thought, was not what it ought to be. But that's kind of shifting, and both Ken and Tracy were very collaborative and supportive of each other, and with Lacey at the table. I think this is a really cool thing, and it'd be interesting to see where this goes next. And it has the support of the Academy of Pediatrics upstate chapter, which is chapter 1. So whatever it's worth, but I think everyone's kind of come together, and we're keeping our fingers crossed.
We're excited. So it's not a problem that we arrived at overnight. It certainly won't be one that we fix overnight, but to be afforded the time and everybody's willingness to say, we typically want the quick wins. And this is not something that we can do in a quick win way. So for everybody's willingness to say, we will be patient, we will trudge through the necessary planning that needs to be done to understand this better, to improve this. It's such a win in so many ways. So
I mean, it could have gone way differently. I mean, one hospital could have tried to run with this and submit the proposal, and then at the detriment to the rest of the county. But that's not what happened.
yes.
I think
State
it's
is
really cool.
forcing a forced union, which is good.
Yes, but we
Well,
can
there's
attest to the
talking.
fact that it happened before even they said that. As I can tell you for sure, they were at the table before the state even said, we really need to
Yeah.
work together. So again, that's why it was just such a hopeful thing for us. Another hopeful and last thing to highlight for all of you, just a couple of other presentations and talking about some really unique partnerships that, of course, in public and community health, we don't think are unique. We think these are very normal, but we're finding that to the rest of the world, the rest of the state, it does seem very novel. But we, specifically Steve Kilburn, has been working very closely with the Sheriff's Department. Sheriff Patrone and his team has been very innovative in researching and finding and implementing some evidence-based programs of their own that really do have sort of this hub and spoke model to them. And they have been gracious to include us from the very beginning and ask for our thoughts and the expertise of the different people in our department to really make this a success. So I believe I've talked with you before quickly about the situation table when we were first getting this up and running. I would love to at some point have Steve, you've never come and talked to them about the situation table either.
Not here.
So we'll have to plan that at some time so you all can get a view of it. Maybe have Vito or the sheriff come as well. But when we do talk about the quick needs and those acute crises type situations that do occur in our community, that is clearly an area of concern as well. And our sheriffs and our first responders are typically the frontline staff that get out there and see them first. And what has historically happened is there is no one agency that can walk a person who is in crisis mode through to resolve, because there's generally multiple issues that are occurring in somebody's life at that point. So the situation table is a model that was born out of Massachusetts, right? Originally,
Actually, Scotland, to Canada,
to Canada.
then not.
Okay.
Now national.
Nationally, and we are the first county, though, in New York State to implement the evidence-based program. It literally is a table that brings all of the players around it. There is a model and best practice for how they triage cases through the table. And there has been a significant number of cases brought to the table, issues uncovered, goals set, resolved and reached within 2 weeks on average time. So some of these cases that, waited around for maybe years with the same issues and problems, we're now seeing these resolved in weeks. So it has been a very successful model, so much so that Sheriff Patrone and his team and Steve have been asked to present a couple of different forums now at this point, both on a national scale with the Sheriff's Association, and then also with the New York State Office for
Treatment for professionals.
Court professionals and
Other state
ORS.
agencies,
Yeah.
Taking note.
Yes, so it has just been a really wonderful partnership, and really kudos to the Sheriff's Department for truly the innovation to ask our public health partner to come in and how can we plan this in a comprehensive and community-minded way from this different perspective that you all bring to it, their openness and willingness to hear and just try some new things. Again, very inspiring to me, very thankful for their partnership. It's one that we can't take the credit for, but we are happy to be a partner in. So it has been a wonderful experience there. That is your report for this month's meeting. Any specific questions or other thoughts or things that we should be considering?
Any impact on the recent withdrawal of funding for teen pregnancy prevention? Certain grants have
So,
disappeared.
I wish Matt were here from TCC because we actually partner with them to do all of that care and work. Nothing that we've heard from them about. We are in close contact with them, but they might not, their funding is so different than what ours was traditionally because they have other compounding federal funds. So I'm hoping that becomes you know, that's the real silver bullet here because they do have this other comprehensive funding and we don't see a blip in it. But nothing that I've heard from them yet. It's more so the nutrition and SNAP Ed funding that we're sort of seeing, you know, trickle down and that we're having conversations at the state level about, you know, we've already been building in some nutrition initiatives just because I'm biased as a registered dietitian myself. So we've been finding ways to really sort of bolster that work through our chronic disease prevention work and outreach that we're supposed to be doing. But there's some talk that there might be some specific mandates and requirements that we may now be tasked with doing. But I feel very prepared in that way to be able to do some wonderful things. Cornell Cooperative Extension has been a big partner in SNAP Ed. They've really been, they hold the funding, that FNAP funding and some of that SNAP Ed funding. So, you know, really probably some support and advocacy for Cornell Cooperative Extension would be important because that it will affect their bottom line. So if there's things that we can do there to support, to ensure that those, we rely on those partnerships. They're the nutrition partner that's going out to our pilot program with the SHIN program to provide the nutrition services. So they are serving in our community.
One good piece of good news, it's fair season coming up. Unfortunately, this doesn't involve Chautauqua County Fair, but Allegheny County Fair, after 10 years of advocacy, is now going totally substance-free. No alcohol, no tobacco, no
That's
no
awesome.
cannabis.
Wow.
And I've been printing signs for the last
Oh.
60 signs and banners, and they're really celebrating that. So
Yes, awesome.
yeah.
Wow.
So we've been working on the other two, you know, Cattaraugus and Chautauqua, and someday maybe, but Allegheny was not the first one we expected to go,
Right, I know.
but they did. So
It looks like,
without wine slushies, that's
yeah,
it looks like clouds on Fairmont is out of business.
yes,
Oh, yeah.
yes.
Yeah.
I finally noticed that.
Thank you. Anything else? There are future meeting dates listed at the bottom of the agenda. Please make a note. I'll entertain a motion to adjourn. Dr. Franz, adjourn. Thank you.